Here's an early post-op knee flexion exercise that I like to use. I actually kind of discovered this one by myself, just doing it on my own knee. Here's an early post-op knee flexion exercise that I like to use. I actually kind of discovered this one by myself, just doing it on my own knee. The typical one is actually using a strap. I'm going to show that real quick, which I've posted about before, where, this is the most common one that I would say is used, where you put the strap on your foot and then you gently pull, go to your range, and coming out, right? Perfectly good exercise, one that I still continue to give to patients and one that I use myself. But I found that some patients like to have a little bit more control. The foot, sometimes just like trying to get there is really uncomfortable because they don't have a lot of knee bending. So even with someone who doesn't have a lot of knee bending, and this is one that, the way that I figured this out was because I was woken up by pain at 5 o'clock in the morning. It was 2 days post-op. I was able to undo the dressing. So I woke up my wife and I was like, can we undo the dressing? So we undid it. And I was just like, I really just wanted to move my knee. I obviously didn't have the strap with me. So I just grabbed my leg and I just started to, I just bend it gently like this, and that's all it really is. As simple as it is, I don't know why that this isn't taught more often. It's nice because you have full control. You can kind of hold onto your leg. And all I did was, again, grab the back of my leg and just pull it towards my chest, right? And you can my hands are doing all the work right now, so there's no real activation of any muscles around my knee. Okay, and then just pull, 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 get to your limit, hang out there, okay, and then let it slide out. And another, obviously, another big benefit is the fact that you don't really need the strap. So if you don't, for whatever financial reasons, maybe they don't want to pay $10, $15 for the strap, you can just teach them to use it with their hands. It's one that you can literally do anywhere because your hands are always with you. You have full control. Some patients have even told me that I've tried it with the fact that they actually like it more than with the strap, just because they feel like they have just more control over it. So again, just grab it, and if they feel like they need more, so once they get to here, sometimes I'll switch my hands to here and pull the shin towards, or you can go one of both, okay? Either way, I just kind of liked it myself, just being able to feel like I was in full control of my leg, not having to rely on my strap, not having to rely on the strap and worrying about the strap sliding off my foot or whatever it is. So, a quick little knee flexion exercise that I figured out on my own, that I actually really like to use. So hopefully it's one that you guys can use and use with your patients.
Thank you for watching today's video. Please feel free to like and subscribe. I have started an ACL mastermind group, which is a program designed for physical therapists, physios, strength coaches, students, and athletic trainers who want to learn more about ACL rehab. It currently holds over 600 videos and has over 500 members, with new videos added every single month. The videos cover immediate post-op to late-stage sports-specific movements and everything in between. Content specifically also includes rehab complications, treatment philosophies, case studies where you can see my real-life patients, movement assessments, exercise breakdowns so you understand how to properly teach the exercises. The exercises are also arranged by difficulty level for strengthening exercises, plyometrics, balance, and neuromuscular control. Of course, it also covers late-stage for movement exercises from structured all the way to randomized and chaotic to mimic more sports-related settings. And lastly, you also learn how to do return to sport testing, which is extremely important, and this what ultimately determines whether or not someone is safe or not safe to return to sports again. There's also questions within the group where you can learn how I engage with patients and their parents of how to answer difficult questions throughout the rehab process, which is inevitable to come up. And lastly, you gain access to a private forum where you can ask questions directly to me and others within the community. We share research articles, we share other equipment and beneficial equipment and things like that. Anything that can come up within the ACL rehab spectrum, that's where you can ask within the private forum. And lastly, you can also download the app where you can gain access in your respective facilities directly on your phones. If you have any interest, please feel free to click the link below, and I appreciate you watching today's video.